So now we're going to be talking about hormone blockers or puberty blockers, a little bit about money, and then when to start cross hormones if you do have a child or a teen where gender has really consolidated. This is very edgy stuff. The medical community and the psychological community are really working hard. The data for all of this is from Holland, and most of the studies are from Holland. So my stuff is in the back. So Shane has already done a really good job of sharing with you how puberty can be a crisis. And they're kind of, no, so this is generalizing. I think the other piece that or the things that were going through my mind when I was listening to the parents. So absolutely a lot of parents don't know, and I think Jane and Dale shared, I mean, they had no idea. So how can you be a parent and not know? I think that is just an incredible, and I think betrayal is a really good word. I hadn't used that before, actually. I mean, this is your kid. How can you not know something so basic and so important as gender? And it's complex. For some kids for whom puberty wasn't a crisis, but they go on to have an awareness later on, someone could say from the outside, well, you're not really trans because if puberty wasn't a crisis, then you're not transgender. And so I think we're getting a more sophisticated understanding of transgender. And the sophistication is everybody's different. There are some trends, and the trends that I see are, the kid who knows at 18 months and takes, the onesies that you snap. You know those? Nod, yes, Okay, so a kid, if any of you have seen Jazz, who was interviewed by, the family was interviewed by Barbara Walter. Jazz unsnapped the onesie and walked around in her dress at 18 months. So she knew, she didn't need social constructs to teach her about gender, she knew. Dylan cannot drive him home over the hill. This is a big, I'm sorry, but that has to happen. Yeah, so there's the very young kids who are aware. They're the kids who know inside, share nothing with their parents, and just have the wishful thinking or the wishful knowing that when puberty comes, they will develop their breasts or they will move into either the gender that they feel themselves to be, which is not the gender they were born with. That's trajectory 2. Trajectory 3 is someone who goes through puberty and has an awareness at more like 18, 20. So I don't know Ida that well to know where she was in that trajectory. And then there's the other one where someone really emerges later on in life and has memories, things come back, something's triggered, where the awareness and truth is true for them. But I think the main thing is and the reason why the gatekeeper is not an okay model is because a person's knowing about themselves is their knowing. And as a therapist or as a physician, you just cannot know that person's truth. Now you say, well, this is so important. How could you ever not have the therapy for 3, at least, and many people say, 3 months, are you kidding? It has to be 2 years. How can someone change their gender without 2 years of therapy? Well, it's complex. And for some people, as I was saying earlier, need the 5 years, others need nothing. Anyway, it's just so complex and so wonderful at the same time. So hormone blockers, in my mind, were what I was looking for hormone blockers. I did not know they existed for transgender kids. I started doing this work in about 2003 with Gusto. And I was meeting trans kids, and I said there has to be something. And indeed, I then met Stephanie Brill and the Transgender Child, which you must read. And she taught me about puberty. I'm going to try to teach you about puberty. Most folks in medicine just this is a blur. Puberty happens because of a pulsatile release from the hypothalamus. So these are a schema in the brain. Releasing in a pulsatile fashion this gonadotropin releasing hormone. That's the GnRH, gonadotropin releasing hormone. That goes to the pituitary. When the pituitary receives this pulsatile release, the pulsatile release of the hormone, then it starts to make luteinizing hormone and follicle stimulating hormone, and that's LH and FSH. That hormone goes to the gonads. If you have ovaries, you make estrogen and progesterone. If you have testicles, then you make testosterone. And that's it. Now the magic, let's see if I have the correct next slide. I don't really. I'm going to go to the picture. So the magic is that if you get gonadotropin-releasing hormone continuously instead of in a pulsatile fashion, the whole thing shuts down. So if it's overloaded with gonadotropin-releasing hormone, then the pituitary shuts off and does not release the luteinizing hormone and follicle-stimulating hormone. This was discovered by accident and has been used for years and years, well, 30 years, for kids who develop puberty too early. And that was mentioned in the Annika. The doctor said this is for kids who are 2 or 3. So if you're 2 or 3 and you get breasts, that's too early. Well, it turns out if you're going through the wrong puberty or you're going through puberty before you know which puberty is right for you, this can be used effectively. So, you know, it's brilliant. I couldn't have asked for anything better. Irene Sills has written the prologue, I believe, for the Transgender Child, and she says, this is a way of sticking a toe in the water without going for a swim. So if you have a kid who gets traumatized by puberty or who is exploring what their gender is and really does not, you know, getting a lowered voice or an Adam's apple or larger testicles or breasts or period, and this is not right, this is the perfect solution. And I really, you know, our bodies are just amazing. So this is another schema. It's not in your handout, and I really apologize. I should try to control myself. I always, the night before, redo the slides, so forgive me. But this is the another schema showing the hypothalamus, which releases the gonadotropin-releasing hormone to the pituitary, and from the pituitary you get the luteinizing hormone and follicle-stimulating hormone that then go to the gonads and makes your estrogen and testosterone. So you now collectively as a group know more endocrinology than most practicing providers. So, and it's complex a little bit, right? But it's elegant. It's so elegant. Okay, so hormone blockers have been used safely for years. So parents understandably are worried. Am I giving something to my kid that's experimental? What's going to happen? Are they going to, you know, develop blue toes or something? No, it's fully reversible. So if the child says or recognizes or the stuff goes down the road to no, I'm okay in the gender I was given, you stop the medication, and between 3 and 6 months later, puberty picks up where it left off. So there's no, in my mind, really no downside if you have a kid. Okay, when do you start hormone blockers? And I'm now going to give you a little bit of developmental pediatrics where we see the Tanner stages. And it's Tanner 2, where you have the beginning of hairs and darkening of the testicles if you're born a boy or born with boy parts. And if you're a girl, a little bit of fulling out, a little bit of hair down in the pubic area. The next 2 slides we can pretty much ignore, but I will say, and the question is posed there, why not start at Tanner 1? And the other thing is, what happens if you've missed that window and you're already in Tanner 3 or Tanner 4? If you're in Tanner 3, it makes sense to start the puberty blockers even though you've missed your window. You can still prevent the further progression of a puberty that's unwanted. If you're in 4, it's probably too late. It turns out that many adults never go to 5. So many of us are in 4. Let's see. So this is the slide that really goes into detail 1 through 5, and I'm not going to go, you can look at that at your leisure, and that's for female. So this is what is in the WPATH, and what you made was so nice. I don't have a handout in front of me. Can you get the page number for what you had in your handout for the guidelines for when to start puberty blockers? It's, I think, page 14. I don't remember offhand, but this is the same thing that Shane has prepared. So you have persistent and prolonged asserted gender identity that is not aligned. Now, I don't think that's an appropriate criteria, because if you have a kid who has said nothing and all of a sudden puberty happens, you're not going to deny.
Are you talking the PowerPoint one or that I showed? Or?
Yeah, just hand me your thing and I'll find it. Sorry.
You're being a mom.
I am being a mom. So I don't agree with this first, page 16. So criteria for hormone suppressants or blockers. So page 16,
this is the letters.
In the letters. So I thought that was really nice how you had the criteria there. So I don't agree with that first one, because you are not going to deny a kid who suddenly expresses to their parents with their dysphoria of puberty that, oh, this is not right, Mom. You're not going to say, well, sorry, kid, you didn't tell me your whole life, so I'm not going to give it to you. No. But dysphoria at the initiation of mismatched puberty, absolutely. Social support system in place, well, you're going to get it into place. If it isn't in place, give the puberty blocker and get it in place. So I don't agree that it has to be in place before you can start it. The absence of a psychiatric disorder that would potentially confound the diagnosis. Again, that's really difficult as well. Shane mentioned this. Many times with the cessation of the undesired puberty, the psychiatric disorder improves greatly. So I don't agree with that one. And in my mind, you really don't have a downside for puberty blockers if you have a kid who's not doing well with the puberty that is emerging. This is also, this quote is in your handout. Adolescents with GID should experience changes of their biologic spontaneous puberty because their emotional reaction to these first physical changes has diagnostic value. Well, if you have a family and a kid who, since 18 months has been expressing their gender, living in their known gender, why do they have to go through the first stages to prove to the world what you already know? So this is, right. So again, there are a lot of families, so I participate deeply with Gender Spectrum, which is a group that Stephanie Brill started. And you have, parents who are, like shaking from angst about their kid going through the wrong puberty. And this is a very real and difficult problem, and we don't really have the right answer. And so there are each case has to be handled individually. And so, you don't want to have a kid have it too early, and yet you don't want to have, like mom, peeking in the shower or the bath. So you actually have to teach the kid what the signs are, and that's what a lot of families do. I'm going to leave this ethical dilemma and just move on, just to say it is a dilemma. So if you never develop the facial hair that will later need electrolysis, then you don't have to have the painful and expensive electrolysis. If you never develop breasts, you don't have to have top surgery. So this is a very elegant way of saving resources, and more importantly, a child's sense of self, and then an adult sense of self. Chaz Bono and Renee Richards did not have puberty blockers, and maybe it's not fair to say they would have had an easier time, but they might have. So, what are the medical risks? There is a decrease in bone density, which actually rebounds and goes to normal once you start the cross hormone or the hormone that you were given at birth. The height for male to female people may be slightly less, but that's probably okay. In our society, typically women are shorter than men. There is some possible decrease in height for trans men, where that you actually want, trans men typically want to be taller. And then there's this theoretical question of delay in cognitive development, which hasn't really been studied, but people think if you're not going through puberty, you're probably not doing the emotional, going through the emotional growth of puberty. And what some could argue whether it's growth. But it's safe, and that's the good news, that it's safe. But they're very, very, very expensive and typically not covered, although Medi-Cal has been fantastic. Locally in Santa Cruz, we have the Central California Alliance for Health. I've never had a problem. I mean, really the next day, I have the Lupron. So Lupron has been used also in grown female. If there's a cancer of the ovaries, we use Lupron, for example, but it is about $3,000 to $6,000 a year. Many families go online and get the Lupron that way or go to Canadian pharmacies. The straight insurance companies typically don't cover it. Now, Hystrulin is a wonderful invention. It is marketed for men with prostate cancer and also women with endometrial cancer, ovarian cancer, and fibroids. It is a matchstick, much like the implant that we use for contraception, originally called Implanon, now called Nexplanon. And it's a very elegant procedure to put it in. And this lasts, they say, for a year. But actually, when we do the testing to measure follicle-stimulating hormone and luteinizing hormone, it usually lasts for 2 years. And you see the price difference there, $3,000 for the adult indication. And if you buy Supralin, which is marketed for precocious puberty, it's $18,000, sometimes $20,000. So I've never put in a Supralin, I've only put in the Vantis. And there it is. It's very small, it's very elegant, very easy. You put a little numbing cream here and then use some lidocaine and pop it in. I've already covered kind of the difficult issues. Well, why not start cross hormones right away? And this is individual management. And the Endocrine Society said wait till age 16. Well, if any of you have teenagers, or you're a teacher, or you're a therapist, starting a kid at 16 is not appropriate in this culture. I think in the Netherlands, so they picked 16 in Holland because that's the age of consent. This was a research study that was done by Peggy Cohen-Katanis, and she had 0 regret, which is perfect. And by the time you're 16, if you haven't killed yourself, you know what you're doing. So in the US, we can't do this. 16 is too late for puberty. So we're doing it sooner. And yeah, it's happening sooner. At Planned Parenthood, I'm backed by the Endocrine Society guidelines because of all the concern on the part of Planned Parenthood Federation of America that people will sue them and, whatever. But I find people to do it for the patients that I have been taking care of. And starting a cross hormone, I got the feedback that I was a little bit, I don't know if negative, but telling you all the problems with hormones. In general, hormones are life-saving. And so starting the correct hormone at 13, 14, 15, 16, 17, 18, you individualize, and when you have the awareness that the cross hormone is needed, that's probably the best time to start it. So this is also in your handout, and it's a very important comment about how it's not a neutral option to say no to these treatments. This is Kim Petras, and you have to Google her when you go home. She's amazing. She's absolutely incredible. She's a teen pop star. She started blockers, I'm not exactly sure what age, probably less than 12, but then hormones at 14, and she had her vaginoplasty at age 16. And this is Annika, whose name is no longer Annika, but it is a journey, and it's an amazing one. And thank you for your time. Time for questions or no? I know I'm a little bit over my time. Okay, questions? Yes?
I'm just curious how you got involved.
Alejandra. She was working at our health center.
Oh.
And she said, you have to learn. And I'm like, okay. And she totally opened my heart. I mean, I went to medical school and learned about transgender as a pathology, as someone who is crazy. I remember the lecture very well, So I've had my heart opened over and over and over, and every single person I see opens my heart more. It's incredible work. And the integrity, the bravery of every single patient I have and all the families has just been incredible. Yeah. Yeah. So yesterday, a child, a 12-year-old, came in from Oakland to get her implant removed and replaced, and she didn't have her implant with her, but I found the name of the doctor and then called them up and talked to them. Well, I left a message, but hopefully I'll hear back. But it does take time, and you have to go, do more than you usually do. And I think what you said about being a social worker is really true. I mean, most of what I do is probably what someone would consider what a social worker should do. But it's so important to do that supportive work. Yeah, it's a great question. So the question is, how do you help a family decide whether to freeze sperm or eggs? So the first thing is and it's amazing. A lot of the teens have done their own research. So a couple of my young patients have decided to go through their puberty because if they don't, then they cannot store sperm. The eggs is a little more controversial. Some people think you have to go through puberty to have a viable egg, and the jury's still not out on that. But so this one case that I know, young person decided not to have the hormone blocker because she wanted to have her own children. And so she went through male puberty, and then as soon as she could ejaculate and have sperm, she said to her mom, now I need hormones. So she just taught the mom everything. But finances, unfortunately, as I alluded to earlier, tend to be the limiting factor because it's very expensive. Yeah. Was another question? Yeah. So so the question is about bioidentical hormones or herbs, and I think Fern asked me that question as well. So we have a lot to learn. So far, most herbs aren't powerful enough for you to transition. For estrogen, so bioidentical is very interesting. So estrase is probably the most it is manufactured, but it is bioidentical. And this is a very interesting, edgy area, and I'm sure I'll say something different next year because we'll know more. There isn't really